Good afternoon. I'm Linda Coos, and I'm so very pleased to welcome you to our first ever virtual campaign kickoff. I am so proud to serve as the 2020 board chair for United Way of Washtenaw County. You know, our world is changing so very quickly, and this past year, United Way's work has been keenly focused on the racial inequities and the health disparities that have been exacerbated by the pandemic. We stand with our community to make the changes necessary to help overcome the systemic barriers that prevent us from reaching our goal that by 2030, zip codes will no longer determine your opportunity in life. We appreciate you joining us this afternoon to officially kick off the 2020 United Way of Washtenaw County Community Campaign. And at this time, I'd like to recognize all the members of the United Way of Washtenaw County's Board of Directors. Our Board of Directors has been instrumental in setting the course and direction of our work and continues to help us navigate during these uncertain times. We could not be more thankful to this dedicated group of individuals who continue to lead us through these challenges. Every year, United Way enlists dynamic and committed volunteer leadership to help spread the word about our community's needs and gather support for our initiatives and programs. This year, we are excited to share Brandon Tucker, Associate Vice President for Workforce Development at Washtenaw Community College, as our campaign chair for the incoming year. Brandon has served the United Way's Board of Directors for several years, in addition to re-energizing the WCC campaign along with United Way's Resource Development Committee. So Brandon, thank you, and I'm turning the screen over to you.
Thank you, Linda. I just want to start off by thanking each of you for being here today and every day for our community. This year, it feels as if the campaign never ended. In March, our world declared COVID-19 a pandemic, and we all felt and saw its effects. To support communities most impacted by the virus, United Ways across the world launched COVID-19 relief funds. And locally, we raised more than $1 million to help keep people fed, provided direct assistance for basic needs and household items that we all struggled to find during the pandemic. We also saw indisputable evidence showing that communities of color were most impacted by the virus, and United Way prioritized these communities for investments. For this reason and many others, we are really not talking about getting back to normal. Normal wasn't working for millions of people, and old and broken systems won't fix those challenges. Now, United Way is focused on a better, more equitable, and more resilient community, and we need your help to get there. Many people have already answered our call for help by joining our campaign cabinet. The goal of our campaign cabinet this year is to grow strong communications between United Way and the workplaces who run campaigns. The campaign cabinet contains some of Washtenaw County's brightest and most philanthropic-minded people. We've had Zoom calls with 20 companies just to thank them, ask them for their support, and to hear how we can help. Even in these unprecedented times, 100% of the communities we contacted shared that they are 100% on board and with us and in support of our community. I would like to also recognize the Leadership Giving Association Chair, J. Paul Dixon. J. Paul is a campaign cabinet member, former campaign chair, and has supported United Way for more than 20 years. Leadership donors contribute $1,000 annually or more to the campaign. Currently, these donors are responsible for over more than $1 million of the total campaign amount each year. Thankfully, this year, J. Paul has some help with reaching out to our LGAs, and I would like to thank and recognize members of our newly formed LGA committee for their support in making calls, sending emails, and doing whatever it takes to help us reach our goals. Thank you, everyone, for your support and your gift. Last but not least, at the helm of our Tocqueville Society is Eric Baker, who is serving his second year as chair for this committee. A special thank you to our committee, who makes more than 80 calls and emails annually to new and current Tocqueville Society members, asking them to renew their gift to United Way of Washtenaw County. Last year, this group alone raised $1.25 million during the campaign. Thank you for all of your help and support this year. And more than any other year, we need each of you to be united with us in equity and support for our community. We thank you, and we look forward to a great year. Linda, now I'll turn it back over to you.
Thank you, Brandon. And thank you to all the volunteers who are committed to both raising awareness and dollars for the United Way of Washtenaw County. And speaking of raising awareness, as a board member since 2017 and volunteer on the Community Impact Committee, I've been focused on how best to invest United Way's resources to maximize positive results. To that effect, I have worked closely with our next presenter, Pam Smith, United Way of Washtenaw County CEO, and will pass the screen to her.
Thank you, Linda. I feel a great sense of honor and pride in the job we all undertake. And United Way's legacy is doing this together. So to each and every volunteer joining us today, thank you. The pandemic laid bare the racial and health inequities in our community. Our system was stretched beyond any limits we could have imagined. Our nonprofit partners were hard-pressed to innovate and communicate, and still found a way to meet the overwhelming demand, even if it meant calling in the National Guard. Friends and neighbors who had never before needed a social safety net were now utilizing our network. Our financial coaches were helping people set up budgets and apply for unemployment. Our tax prep staff and volunteer corps still figured out a way to help 1,000 people get their taxes done. A program that brought $1.7 million back to this community to be spent here in Washtenaw County, a socioeconomic boost for everyone. United Way's value was even more apparent as we mobilized around the COVID-19 virus and raised over $1 million and sent 100% of it right back out into communities that were hardest hit to serve our neighbors. United Way has always been here to help, and our work as an anti-poverty and anti-racist organization began years ago. United Way of Washtenaw County was the first United Way to launch a 21-day equity challenge. When I first participated in the Food Solutions Network free and open source equity challenge a few years ago, I knew I had to bring it to Washtenaw County in some form. With the help of Bridget Healy and our chair at the time, Yodit Mesfin Johnson, we had 5,000 people participate in our first challenge held in January of 2020. We then hosted an equity summit on the heels of a snowstorm and school closures, and yet more than 250 people showed up to engage, listen, and learn from diverse panelists and each other on what this community needs to move forward. Our work is gaining traction. The United Way Network is now holding their own challenges around the state and the country. Our VP of Advocacy and Impact, Bridget Healy, was on a national committee to build the United Way Equity Framework. United Way Worldwide launched a challenge and passed membership requirements to further our commitment to equity. And our board of directors has authorized funding to launch a justice fund, putting money, time, and advocacy into transformative relationships within community. Through it, we seek to disrupt the systems that perpetuate racism, poverty, and trauma, and to be an ally to Washtenaw County's people of color as they build power, agency, and resilience. We need you. We believe united action is powerful, and it benefits all of us to have a greater collective capacity. One of our partners in bringing conversations to the public is Lucy Ann Lance. United Way has had a monthly segment on the Lucy Ann Lance Show for years, and we are so thankful that Lucy Ann has agreed to bring her show to you today. She's interviewing our community experts in health, education, and financial stability to share how inequity affects local families and how you can be part of the change that we need to see. Please welcome my friends Jimena, Bonnie, and Ugbad. Lucy Ann, take it away.
Thank you, Pam. It's an honor to be here. United Way of Washtenaw County recognizes that the strength and vitality of an entire community is tied to just and equitable access to resources and opportunities. The United Way's vision is that by 2030, your zip code will no longer determine your opportunity in life. You may be surprised to learn that currently in Washtenaw County, it does. Washtenaw County is known as an economically diverse community, vibrant, educated, and healthy place in Michigan. But not all residents share in the prosperity that defines quality of life. The United Way believes that we can and must do better as a community. But we can't do better unless we address the forces that are holding us back. For the United Way, racism, poverty, and trauma are those forces. You will hear shortly from 3 individuals who are addressing these forces every day in the work they pursue. Their efforts ask of us as a community and of you as an individual the following questions. Who gets access to education? Who do we protect from illness? And who is worthy of financial well-being? So let's meet our panelists. First is Ugbad Kanan. She is a financial coach with the United Way of Washtenaw County. Ugbad is the driving force behind the revitalization of United Way's financial coaching program and financial navigation services. She helps community members move towards financial self-sufficiency. This includes assistance with creditors, student loans, utilities, and unemployment. Bonnie Billups. He is the executive director of Peace Neighborhood Center. For nearly 50 years, Peace Neighborhood Center has been providing programs for children, families, and individuals who are affected by social and economic problems. And I can attest to Peace's success. And that is because I have known Bonnie nearly my entire life. Today, he's executive director of Peace Neighborhood Center. But back in the day, he was a Peace kid. He is proud to have served the youth and families of Washtenaw County for almost 40 years and to lead Peace Neighborhood Center since 2006 in its role as a pillar of the youth and family service nonprofit community here in Washtenaw County. And finally, we welcome Jimena Lovelock, health officer at the Washtenaw County Public Health Department. Jimena has worked in public health her entire career. She is the first Latinx and first bilingual health officer for the county. She has been instrumental in bringing health equity and racial equity to the forefront of the work and decision-making at the health department and the county. Her biggest challenge to date, arguably, is managing COVID-19 and the crisis locally. Well, to start, we are going to zero in on one of the harmful forces identified by the United Way, racism. Often what people think of is interpersonal racism. Only seeing this level means that we fail to see the full picture that keeps the system of racism in place. Systemic racism or institutional racism refers to how ideas of white superiority are captured in everyday thinking at a systems level, taking in the big picture of how society operates, rather than looking at one-on-one interactions. Systemic racism assumes white superiority individually, ideologically, and institutionally. The assumption of superiority can pervade thinking consciously and unconsciously. Under systemic racism, systems of education, government, and the media celebrate and reward some cultures over others. So let's examine those concerns further with our panelists. Our question to start is, how does racism, interpersonal, institutional, and/or systemic, impact the work you do in our community? And we'll start with Ugbad, a financial coach with United Way of Washtenaw County. Ugbad, Alice, asset limited income constrained employed, is a new way of defining and understanding the struggles of households that earn above the federal poverty level, but not enough to afford a bare bones household budget. So talk about the latest data that has come out and also how that applies to your coaching participants.
Absolutely. In the most recent report in Michigan ALICE data, it was found that 63% of Black households are unable to afford basic household essentials in their communities too, which is completely and very different from white households in our communities as well too. We know that the communities that deal with financial instability often tend to be communities in colors, and it's because of the systemic issues in all the systems that they interact with in their day-to-day lives. In our current coaching practice, we mostly work with not only people of color, but women as well. And we see specifically in areas of wages, a lot of disparities. It can be really hard when you're working towards improving your credit, trying to build up an emergency savings, do basic things like wanting to be able to buy your kid a new pair of shoes or maybe go on a vacation one day to reach those goals when you're just struggling to make it day to day. We often hear about this. Go ahead.
Contrast that with living wage and talk about how a living wage, as it's known, would help improve that situation for these individuals in particular.
Absolutely. Another part of the Alice report is a survival living wage, which in Washtenaw County is $13 an hour. But the important piece of that people don't always talk about is the number of hours you're able to work. We've also often heard about people making $15 an hour and how that's a living wage or a thriving wage. But that only really works if you're able to work 40 hours a week. I personally have worked with many clients who sometimes are making that much or they're making less, but if you don't have enough hours to work, you still struggle to make ends meet. But when you're able to make enough, that's when you can start to put money away towards savings, which especially with COVID, we realize how important it is as we see people deal with the economic instability of kind of our day-to-day lives right now.
Bonnie, as the Executive Director of Peace Neighborhood Center, let's talk about the challenges that your students face navigating a white dominant education system and how that plays into some of these inequities that you see with the families that Peace serves.
Yeah, well, I think it's extremely important for us to realize that we live in a fantastic country, but for over 400 years, there was slavery or Jim Crow and laws that separated people and kept a race of people down. It's only in my lifetime, 60 years, less than 60 years, that we have the Civil Rights Act. So when we talk about ingrained systematic racism and other things, it's a part of our society that I think now we're able to look at and start thinking more about and understand that it's more than an individual situation, but a real situation of our institutions and things that are in place. That means that it's also a part of the school district. When you look at, for example, that 40% of the young people who are suspended from school are African American, but they only make up 16% of the school population, there's a problem there. And those issues and those things are things that we're facing daily, working with young people and working with school districts to be able to have the similar expectations and to see the greatness in all the people that come through the doors and not just families who have. And so that's some of our effort.
Do you have other examples to help illustrate the problems that you have seen in the schools with children?
Sure. I mean, you, of course, have heard about the school to prison pipeline and the fact that if you have numerous kids who are suspended or expelled from school, that they're more than likely to end up in the prison system, in the court system. And of course, we pay for that court system and when we should be proactive in making sure that we're providing systems or things in place to help kids to be successful. When we talk about expectations of people who are Black children, who are African-American children who are in schools, and the expectations for them is not the same success as their white counterparts or their economically successful counterparts. There is some work that we need to do at changing the system so that expectation is happens for all kids and all people who are involved. So, we can talk about the suspension rate, we can talk about the expulsion rate, and those are things that we can tangibly put our hands on. But we also need to think about the fact of how kids are seen by the teachers and the administrators within that school district. If you're seen as being possibly successful, look at the amount of children, of African-American children, who are not given the opportunity to be in AP classes or who don't sign up for AP classes. I can tell you that I've had plenty of cases of kids who have signed up and they're the only African-American kid there. And sometimes it's been, why are you here? You shouldn't really go to this class. This is really a little bit harder for you. You should do something different. Just expectations that way are parts of what we see as issues sometimes.
And how do the programs at Peace Neighborhood Center help fill that gap then? I mean, you just said something that really struck me, and that you have had Peace Kids sign up for AP classes. Obviously, that's something that you're directing them towards, and that's advanced placement classes, of course. Does you take a really active and involved outlook on the population at Peace?
Exactly. Our youth programs and services are designed to get kids and see the vision when they're in kindergarten for them being in college or in a career that they will be excited to be a part of, that will be able to allow them to be self-sufficient and to be a contributing member completely of our society that we all live in. So from the very beginning, when a kid comes in programs, that's our vision. We're holding that vision. We're doing the efforts to make you along that continuum to go from kindergarten to middle school to high school and then into our college and career prep program, and to put you on a track to either go to college or go to a skilled trade program that allows you to be successful in connecting kids and young people to those resources.
That is positive empowerment, isn't it?
Exactly. Exactly.
That's
and
really
seeing the greatness, seeing the possibility of people and holding the vision, even when that kid can't see the vision, what he or she can become, holding that vision for them and giving them the routes to be able to be successful.
Sometimes paving the path is all it takes. And Ugbad, I think you see that too, because when you're helping people understand their finances better and how to manage their money and all the great resources you do through the United Way financial programs, when that light bulb goes on, that must be so rewarding.
Absolutely. It's sometimes it shouldn't be shocking, but it is shocking how many people come to me and say, I was never taught these things. I wish somebody had taught me these things. I wish it was something I got to learn in school. There are lots of things I learned that I still don't even use. And it's really empowering, not only for me, but I think for the people I get to work with as well, to then get to know that they have not only these tools, but they can put it into play in ways that work for them and not only help benefit them, but their families and their communities as well.
Another great resource in our community is our Washtenaw County Public Health Department. And again, a personal note, I've had some great experience with the County Public Health Department because I suffered from COVID-19, was in the hospital, and I lost my fiance. And the staff at the County Health Department was just so incredible when I got home, and checking in on me and talking with me about symptoms and doing the contact tracing. Jimena, it was just incredible. Your staff is phenomenal, and I thank you from the bottom of my heart.
Thank you so much, Lucianne. And again, my condolences on your loss. I'm so glad to be with you, though, today. And that is what our health department, that is what our staff does every day. And certainly COVID has highlighted the importance of public health and our local health departments. I think people know more about public health today than probably they've ever paid attention to before. But that's because a lot of what we do is we work to prevent illness. We work to promote health. And so a lot of the work we do, you don't always see because we're there every day trying to prevent chronic disease, trying to promote healthy eating, access to healthy foods, clean water, safe environment. And COVID certainly has brought to light not only the importance of our public health system, of having a strong public health system, of our local health departments, but of course it has highlighted, I think even more so, the health inequities that we experience across the country, in our state, and particularly in our own county.
Share the data with us because COVID-19 has had a horrendous impact on the Ypsilanti area and on persons of color.
Yeah, we actually, from the very beginning, started collecting and doing surveillance, collecting data, doing surveillance on what we were seeing with COVID-19 cases. And it's very important to be transparent and to share that data in a disaggregated manner so that we can see not only the disparate impact that different diseases like COVID-19 have on different populations, in this case, particularly African Americans, but so that we can use that data to act and to really address the needs and to promote wellness and access to healthcare for populations that are particularly impacted. And so in Washtenaw County with COVID-19, we saw a disparate impact in the African American community, and particularly also in our 48197, 48198 zip codes. So if we look at our cumulative cases of COVID-19, we have a total of 48% of those cases being among residents in those two zip codes, even though those zip codes account for only 29% of our county's population. And then with the impact on the African American community, which makes up 12% of our population in the county, we have 28% of our cases among the African American population. And also more distressing is that 39% of African Americans have been hospitalized. So they've had serious enough illness that they've had to be hospitalized because of COVID-19.
Do we know why? What is the connection there?
Well, I think, first of all, we were seeing very early on the impact of the stay home, stay safe order, and the unequal ability for many people to stay home and to do work from home. Many people working in the service industries, being essential workers, they didn't have the ability to stay home. And so they continue to go out in public and interact with others, putting themselves at risk in order to ensure that our services and the services we rely on were able to continue. But the other thing also is that we know that because of the institutional racism that is absolutely a daily impact on public health in general, we know that also our healthcare system is not often accessible to people of color. There's often a lack of trust based on history with our medical system. And also there's a lot of implicit bias that impacts the delivery of healthcare. And so we also see that there's a whole range of factors that impact the COVID-19 risk as well, which don't necessarily just have to do with healthcare or access to healthcare. It's related to the access to sick leave and health insurance. It's related to the housing conditions that people live in. And so with a disease like COVID-19, where you can, if you have a case in your household and you have others in your household and you're not able to isolate or quarantine, then certainly the virus can be transmitted more easily. And so we really saw a very disparate impact, not only in that geographic area of our county, but in the African American community, but also in general with communities of color. Recently, we're seeing an increase in the number of cases among our Latinx community. And certainly there, we're particularly sensitive to the language issues as well as the concern around immigration status. And again, kind of being able to provide services in a way that is sort of community driven and through trusted service providers.
One area that the county public health has long been involved in is the health of babies. And I'm curious what low birth weight in persons of color might have to do later in life with these kinds of events where we have this horrific virus that hits, and comorbidities was a part of the problem for many people. If you had diabetes or any other underlying conditions, have you been able to trace it back to something, even to birth?
Not as of yet. We certainly know, though, that again, like many other illnesses or chronic diseases, as well as health outcomes in our county, we see again racial disparities. And so in Washtenaw County, African American infants are 4 times as likely to die within their first year as white infants. And so what's so important continuously, but I think with COVID-19, we're really focusing on what more needs to be done to promote optimal health and to ensure that we're able to not only provide accessible healthcare, but that we're able to provide that healthcare in a way that really addresses the holistic aspect, the social determinants of health that impact those health outcomes. Because clearly health outcomes are not just based on our genetic factors. They're very much based on on the environment in which we live. And we also have just declared racism as a public health crisis in Washtenaw County. Our Board of Health did that. Our Board of Commissioners did that. And I think that's really a first step to looking at the institutional racism, the systems that really impact the health outcomes of our residents.
Jimena, how else is the Public Health Department addressing these health inequities in our community? What other kinds of things are underway?
So I think the health department, first of all, has focused on addressing health inequities for years, and it's a major guiding principle for us in the health department. And we recognized many years ago, as we developed our guiding principles to address health equity, that really racism had to be part of what we tackled, what we really had conversations about and really explored further, not only as a health department, but as a community, if we were going to make any impact in promoting health for all. So for us, a really important part is community engagement and bringing community members to our decision-making table. And we do that in partnership with various community leaders, community members. We have developed a Community Voices health equity leadership team that works very, very closely with the community. We focus on 6 different populations and geographic areas in our county that have been identified by us through our data and our community health assessment process to have, particularly high health inequities, high levels of health inequities. And so much of what we do is work with community-driven solutions to community-identified problems or challenges, and really helping to prioritize what community members think, feel is sort of their priority in terms of improving the health of their fellow community members and neighbors, and really working with the expertise of the health department in partnership with the expertise of community members. So it's really changing the decision-making process and doing community engagement in a way that brings community members and community voices to the table.
Thank you. We're here today at United Way's virtual campaign kickoff in a very different format from years past. United Way works to create a thriving community for everyone by bringing solutions focused on education, health, financial stability. These are the building blocks for a good quality of life. And they do so, the United Way does this with an eye sure people get what they need, not just to get by, but to get ahead. And the United Way has been doing this work for 99 years in Washtenaw County. And so we know the value our United Way brings to our community. So now I'm going to ask you, from your perspective, what is the value to our community of the United Way? And Bonnie, I'd like to start with you. What value do you see at Peace Neighborhood Center with the United Way?
Well, at Peace, we have this statement that we say, changing our community one person at a time. And I think that when you look at United Way, it's changing large groups of our community at a time to make our community better. So it's invaluable as far as the support that we have felt from United Way and all of its supporters over 30 or 40 years. It allows us to do the things to help people find their greatness and help to change lives of people. So,
change lives indeed. When you look at the vast array of services all of these nonprofits like Peace and many, many others give to our community. And Ugbad, you've got an interesting perspective because you work through the United Way with the financial programs there. Perhaps you could give us your perspective on the value of your own organization, the United Way, through the eyes and testimonies of the people that you work with.
I think the value is, again, right there in the mission that you just read, right? Connecting people, resources, and organizations together. It makes me think about one instance with somebody I was working with who was struggling with a payday loan, and I referred her to her community partner, Friends Indeed, who helped her pay down that payday loan. Then she had an extra couple $100s each month to work on her credit. And then now she bought a car, which is going to help her ensure that she keeps her job that she was really worried she was going to lose due to a transportation barrier too. So the wide scope that it had, the impact that it had on her life just from being able to work with a community partner. I also think getting to witness the work done with the COVID-19 Relief Fund and supporting those other critical nonprofit partners who make up our social services network that are on the front lines of helping keep community members and community partners above the line. You get to witness that every day, and it's definitely a privilege.
That's beautiful. And Jimena, about from your perspective with the Public Health Department, what value do you think the United Way brings to our community?
Well, I think they are one of the leaders in helping to have dialogue around racism and health equity and other equity issues. Their 21-day equity challenge. I know the health department participated in that. The county as a whole participated in that. And I think it was a great kind of effort to spur dialogue and ideas exchanged in all kinds of settings, businesses, government, nonprofit sector, to really think about the issues of equity and racism. And of course, with COVID-19, I can't stress enough the importance of having United Way step in to help answer the need and really ensure that community members continue to have access to essential services that were being provided by our nonprofit organizations and even some new organizations and individuals that stepped up when they saw the need in their community.
You know, every day our community asks each of you to do the good and necessary work of helping to create this thriving community for everyone. You're faced daily with continued unmet community needs, and yet you show up to work choosing instead to see not the impossible, but what is possible. As a community, we certainly ask a lot of you. So what is your ask of the community? What action do you want those watching this to take? And let's continue with your thoughts, Jimena, on that.
Well, first of all, as the health officer, I certainly would have to say that I want everyone to stay safe and to follow public health guidelines to keep themselves safe from COVID-19. So wash your hands frequently, maintain that 6 feet of distance from others, wear a mask, and follow other guidelines that we've put in place locally here in Washtenaw County. So I have to say that. But of course, you know, kind of in a broader scale, I would say, you know, understanding the importance of not only public health, but how all of our sectors really are connected, and how by supporting United Way, you can have an impact on a broad scale because of the breadth of partnerships and the variety of sectors in which they work.
And Bonnie, what is your ask of the community? What action do you want those watching to take that would be beneficial to Peace Neighborhood Center?
Of course, we want you to support United Way. The other thing is that we want people to believe in the greatness that we can have as an example of this community of fairness and equality for everybody from all these different aspects, from education, from health, and from financial literacy, to make sure that we're supporting all of those things to assist our community to be a better community and to get up every day like we do with that belief that that's what we're doing and that's what we see, and understand that we see that in the people who come to us for services. We see that in the lives that have been changed by the support of United Way and by this community. And we need that to continue.
We need to think of not just about ourselves, but our whole community, because we're a member of that community. And Agbad, some final words from you as well. What actions do you want us to take?
Well, part of our financial coaching program has a lot to do with change, creating change, looking internally and seeing what change you can create too. So my ask is to look at where you exist and the places that you intersect, the institutions, the organizations that you get to be a part of, and looking at where can I help to create change? Where are the barriers that I can help to break down? And when and where, give, advocate, and volunteer.
I love that. United Way has a vision that by 2030, your zip code will no longer determine your opportunity in life. You've heard today from 3 wonderful individuals in our community who, alongside our United Way, are working to make that vision a reality. Well, you too can be part of the solution. And here is how. 1, make a donation to United Way. Do that today. Your dollar has tremendous power to help our entire community rise up and thrive together. 2, volunteer. Volunteer your time and talent to a local nonprofit. And if you're wondering where you can volunteer, visit volunteerwashtenaw.org. You will be so uplifted by the ways you can volunteer your time and talent to help others. 3, become an advocate to change the systems and policies that keep the forces of racism, poverty, and trauma in place. And finally, 4, join us for what we're calling a 21-day equity challenge. Have you taken the challenge yet? This is a self-guided journey for participants to learn about the history and impacts of racism here in Michigan. It kicks off on September 8th. We'd love for you to participate. My thanks to our great panel. I'm Lucy Ann Lance. United action, it's powerful. The United Way of Washtenaw County can't do it without you. Thank you.
Thank you, everyone, for being such an important part of our community. Our local nonprofit agencies help our community thrive. Let's give all of our nonprofit agencies participating in today's kickoff a round of applause. All across Washtenaw County, people are seeing the possibilities and feeling the impact of our teamwork. We need to make sure that we give it our all, and let's build a brighter tomorrow, because great things happen when we live united. Thank you all for attending today's virtual kickoff. Share your United Way story with your friends and family, and give, advocate, and volunteer to make a difference in our community today.